are pleased to begin today's program with a panel discussion, as I said, about Saving Our Veterans Lives Act. Our panel discussion will be led by Bill White, our very own Senior Manager of Policy and Legislative Analysis, and will include a question and answer session moderated by our very own Dr. Dave Jobs of the National Public Policy Council and Board. As part of today's panel discussion, you'll be hearing from Dr. Paul Nesdat, a retired Army Master Sergeant you'll be hearing from Dr. Paul Nesdat, retired Army Master Sergeant Chris Allen, and John Retzner. Dr. Nesdat is the James Waugh Professor of Psychiatry at Johns Hopkins School of Medicine and Public Health, where he serves as Medical Director of the Center for Suicide Prevention. As an inpatient psychiatrist, he treats patients who suffer from comorbid substance use, substance dependence, and other serious mental illnesses who require acute management. He also directs the Anxiety Disorders Clinic and works in the Esketamine Clinic at Johns Hopkins. Dr. Nesdat is a leading expert on suicide risk, lethal means access, and the limitations of risk screening. Chris Allen began his military journey in 1988 with the U.S. Navy as a fire control petty officer aboard the USS Wainwright. After a 10-year break, his sense of duty led him back to service, joining the South Carolina Army National Guard as a commissioned officer with the, and you're gonna have to help me, is this 1/151? Apache Reconnaissance Battalion, where he deployed to Iraq in 2011. Chris later transferred to the 51st Military Police Battalion and reclassified into the Military Police Corps, continuing to lead and mentor soldiers across diverse missions and environments. Chris serves as the treasurer of AFSP's South Carolina chapter and as an out-of-the-dark walk chair for Columbia, South Carolina. He is passionately committed to suicide prevention, resilience, and primary prevention. His work focuses on creating a culture of connectedness, reducing stigma, and equipping military communities with evidence-based tools to promote well-being. John Retzner is Deputy National Legislative Director for Health for the Disabled American Veterans, DAV, which is a veteran service organization dedicated to empowering veterans to lead high-quality lives with respect and dignity. John served in the U.S. Army from 1991 to 1995 and continued his service with the Army National Guard until his medical separation in 1999. His responsibilities for DAV, the Disabled Americans Veterans, includes advancing legislation and policies critical to disabled veterans and their families. And Dr. David Jobs serves as a member of AFSP's Public Policy Council and National Board of Directors, and is a leading expert on suicidology and suicide prevention. Dr. Jobs serves as a professor and associate director of clinical training at the Catholic University of America and has worked extensively with the Department of Veteran Affairs and as a consultant to each branch of the U.S. military. And Dr. Jobs just also recently was awarded esteemed award from the International Association for Suicide Prevention, correct? Yes. So with that, you'll find this panel discussion inspiring and informative. I know this. And so now I'm going to turn it over to Bill. Thank you.
Well, thank you all so much for being here. Today we'll be talking about the Saving Our Veterans Lives Act. That's H.R. 1987 and S. 926. But first I want to begin by talking about why preventing suicide among veterans and their families is such a central mission to AFSP. U.S. veterans face a much higher risk of suicide than the general public. In 2022, the most recent year for which data are available, male veterans had a 44.3% higher suicide rate than the general U.S. public among men, and for female veterans, the rate of suicide was 92.4% higher. Veterans also face higher risks of contributing factors for suicide, like post-traumatic stress, traumatic brain injury, and social determinants of health. Suicide is the 12th leading cause of death among US veterans. And I want to point out a striking statistic here. Since the September 11th attacks, more than 4 times as many service members and veterans have died by suicide than have died in military combat. I want to let that sink in for a moment. We all have a role to play in preventing this ongoing tragedy. We can all do more to help protect those who protected our country. And so I also want to talk about the role that firearms play in preventing suicide among veterans. The legislation that we'll be talking about today is focused specifically on preventing firearm suicide and on secure firearm storage. And that's because the rate of suicide by firearm among US veterans is 69.6% higher among veteran men than among men in the general US public. But among female veterans, it's 144.4% higher. That's more than double the rate of firearm suicide. Owning a firearm does not raise your risk of having a suicidal crisis. It does not seem to raise your risk of experiencing suicidal ideation or depression or anything like that, but it does raise your risk of dying by suicide. Why is that? It's because of access to lethal means. In other words, firearm owners are no more likely to experience a crisis than the general public, but they are more likely to die by suicide, specifically with a firearm. That's because in a moment of crisis, they often have easy access to lethal means. That is also true of their family members, as we'll get into in a moment. And I just want to let that sink in for a moment. What we need to do if we're going to prevent firearm suicide, whether it's among veterans or among the general public, is provide lethal means safety, ideally voluntarily. That begins with secure storage in the home. There are a number of other issues we work on, but again, the bill we'll be talking about today is specifically focused on getting secure firearm storage devices in the hands of veterans across the country. And this is also a youth suicide prevention issue. In the US, 79% of firearm suicides among children took place using a family member's gun, as do 43% of firearm suicides among young adults between the ages of 18 and 20 years old. Among women, nearly a third of firearm suicides occur using a family member's firearm. In nearly all of these cases, these are firearms that were kept in the home unsecure, not kept locked up, not kept with a gun cable, or otherwise with a device that would prevent access to someone who isn't the authorized owner of that firearm. And given the higher rate of firearm ownership in veteran and military households, this is likely much more prevalent among veteran households. We don't have specific data on that, but it logically follows, given the higher rate of firearm ownership, you are likely also seeing a higher rate of youth suicide with firearms in veteran households. So, again, what can we do about that? It begins with secure storage and lethal means safety in general. Secure storage can prevent these tragedies. If an individual lacks easy access to lethal means, they will most likely not die by suicide. If someone does not have easy access to a method of suicide, they will most likely not find another. Secure storage prevents access for family members, including children, and by denying that access, you are likely saving that person's life if they experience a suicidal crisis. And for the authorized firearm owner themselves, even the few minutes it might take to unlock a lockbox, the couple of minutes it might take to unlock a gun cable and remove it from the barrel of a firearm, that can save a life. Most suicidal crises are brief. Most suicidal crises last less than 20 minutes. And every moment in that, every second, every minute matters. That's an additional minute where the crisis can de-escalate, where the person can receive help, where they can dial 988, and if they're a veteran, they can dial 988 and press 1 for the Veterans Crisis Line. Research consistently demonstrates that secure storage devices prevent suicide and self-harm. And so with all of this in mind, these are the problems I want to be on your mind when we're talking about the Saving Our Veterans Lives Act. These are the problems that the bill is seeking to address. In the House, this bill is led by Representative Chris DeLuzio, by Representative John James, and by Representative Brian Fitzpatrick. And in the Senate, it's led by Senator Angus King and by Senator Tim Sheehy. This is a bipartisan bill. I haven't listed the party IDs of each of these members, but please know these are all Republicans and Democrats working together to address this issue. What this bill would do is it would direct the Department of Veterans Affairs to provide secure firearm storage devices to any veteran in the country upon request. The bill would direct the VA also to develop and publish informational materials on this, including on their website. In short, requiring the VA to undertake a public awareness campaign both about the availability of these devices through this program and about the importance of using them. Doing so would protect veterans and their families and prevent firearm suicide for the reasons we just went through. Again, this doesn't restrict a veteran's access to firearms in any way. It just helps veterans keep their families safe. It helps veterans keep themselves safe in a moment of crisis. Again, this legislation focuses on voluntary lethal means safety. It does not in any way prohibit a veteran from owning a gun. It doesn't require a veteran to store their firearms in a secure manner, though it would be good if they did so. It does not in any way keep track of which veterans own guns, which veterans receive secure storage devices through this program. The only thing it would track would be the number of secure storage devices distributed through this program. And it would require the VA to keep note of any challenges they run into along the way and report that out to Congress. Your voice can make a difference. And this is a point I really want to drive home, because being honest, when we talk about guns, when we talk about firearms, we don't normally think the word progress. Especially at the federal level, we don't normally think that this is an issue where we can make forward momentum. This is a bill where we can. This is a part of this issue area where there is bipartisan consensus, where we can build support for this. And what this bill specifically needs right now is for all of you to go across the Hill and speak about the importance of this issue. Speak about why this is a bipartisan issue, how this doesn't infringe on anyone's rights, and yet would likely save thousands of people's lives. And so, by helping to elevate this legislation, you can make this a priority on Capitol Hill. There's already bipartisan consensus. We just need to elevate it. We need to raise awareness of this bill, talk about why it's important. Obviously, right now, efficiency and spending is a huge issue on the Hill. This bill only has an authorization amount of $5 million. That's a fairly low amount for the federal level. Could be increased, but what I'm trying to communicate there is this should be an easy sign-on for any office on Capitol Hill. And so finally, I just want to close my remarks here by talking about core talking points to take away from this. If you take away anything from this, I see folks raising up their phones to take pictures, please do. This is the takeaway slide from my remarks here. Nearly 3 in 4 veteran suicides involve firearms, 73.5%, as do nearly half of suicides among children and adolescents. Most individuals who lack easy access to lethal means, like firearms, will not die by suicide. And this bill will help veterans store their firearms in a secure manner, protecting their families without infringing on their rights in any way. And with that, I'll pass it over to Dr. Nestat. Thank you all so much.
Thanks, Bill. That was really well put. And what I'd like to do while I speak to you is to focus on those core points that Bill listed at the end and give you a little bit more detail, a little bit more of the numbers that go along with those core points so that when you're speaking to legislators tomorrow, you're able to sort of draw a straight line between what the research shows and how this bill will save lives directly. All right, so I'm a psychiatrist, but I'm going to be talking about research mostly, so it's a little bit dry, but it's going to be a lot of numbers. I won't read everything, but I want you to remember what some of you already know, which is that suicide rates have been climbing in this country for 20 years. Our rates now, over the past couple of years, are the highest they've been since we've been keeping track, since World War II. But among veterans, the suicide rate is more than double the general population rate. In fact, as you've heard today, we lose about 18 veterans per day to suicide, making it the second leading cause of death for vets under age 45. Bill mentioned that we've lost more vets to suicide, 4 times as many vets to suicide, as we have in all combat operations in the U.S. Since 9/11, basically. And it's worth pointing out also, relevant to this bill, that most veterans who die by suicide had not been in VA care in the past 2 years. So this bill extends what's going on now with distribution through VAs to veterans who are not involved in the VHA. Let me skip ahead to this. Despite the suicide death rate being really high, it's worth mentioning that it's dwarfed by the suicide attempt rate. Suicide attempts happen very commonly in the U.S. In fact, there's about 1.4, 1.5 million suicide attempts each year in the U.S., many of which require hospitalizations, but only about 50,000 of which result in death. The reason for that has to do with the methods used in those attempts. There's a couple paradoxes in suicide research. One that every medical student learns is that women tend to attempt suicide much more commonly than men do. Women have about 2 or 3 times the attempt rate for suicide. But men make up 80% of all suicide deaths. They have 3 or 4 times the suicide death rate. Generally, that comes down to the methods used by the 2 different sexes. If you look at this table here, this is a study by Connor that looked at about 8 years' worth of all suicide attempts that were documented by the CDC in the U.S. over 8 years. That's almost 4 million deaths, if you look at the bottom line there, 3.8 million deaths. Thankfully, only 300,000 of those resulted in death, So we get this statistic that you might hear a lot about suicide attempts having about an 8% fatality rate. So most people survive. In fact, the most common method used in suicide attempts, is poisoning, which is overdose by opiates, sleeping medicines, Tylenol, whatever. But thankfully, even though that's the most commonly used suicide attempt method, it has a very low fatality rate. As you can see on that second line there, only about 2% of attempters that do use overdose do die, which means that most go on to survive, and we'll talk about what happens to them in a second. However, if a firearm is used, and firearms are only used in about 5 or 6% of suicide attempts. If a firearm is used, the chance of fatality is very high. It's about 90%. Men tend to have firearms more often than women, so men tend to use firearms more often than women, and so men tend to die in their suicide attempts much more often than women. And the same applies to vets, as we'll see in a slide or two. So even though 5 or 6% of attempts use guns, only 5 or 6%, they become the majority of suicide deaths. The latest data shows it's about 55% of suicide deaths are by firearm. The second highest would be things like suffocation or hanging, which only has about a quarter of suicide deaths. With veterans, as you heard from Bill, the rate's even higher. Among veterans, firearms are used in 3/4 of all suicide deaths. In fact, in any population that has access to a gun, we start to see higher rates of suicide death and higher proportions of those deaths being by firearm. Let me skip back here a little bit. So as Bill said, so I want to highlight this, veterans are not necessarily more likely to attempt suicide than civilians. Gun owners are not necessarily more likely to attempt suicide than non-gun owners. But veterans' attempts are far more likely to be lethal because disproportionately they do use firearms more often because they own firearms more often. So we have to think about veteran suicide inextricably linked to firearm prevalence, availability, and access. Gun suicides really are what drive the increased veteran rates of suicide in this country. If you look at this figure I put here, this is the suicide rate among veterans divided by method. The red line is firearms. You see that the suicide rate has been going up in veterans, as you've heard from me and from Bill. But it's really just the firearm suicide rate that's really gone up. The poisoning, suffocation, all other methods have stayed approximately the same, but firearms have driven this rapid increase. So there's lots of risk factors for suicide. I won't go into an exhaustive lecture. Trust me, I can lecture. That's my day job. But I will say there's many factors, genetic factors, psychological factors, exposure to suicide, trauma, obviously. But all of those things lead down a common path where you can see a split where an attempt is made. And that attempt either results in a suicide death, 50,000 Americans each year, or a survived self-harm attempt, a survived suicide attempt. And the only thing that determines whether that attempt results in death or survival is if the method used is likely to be lethal. And the method used really just comes down to what's available to the person when those suicidal thoughts overcome them. To understand that, these are some numbers that are useful when you're talking on the Hill. To understand that, it's worth understanding the impulsivity of suicide. And I will say that not every suicide attempt is the same or is come to by the same path. But I'm an epidemiologist, so I speak in averages and generalities and what we see most of the time. Simon did a study about 20 years ago of 150 people that had made high lethality suicide attempts, but had survived, and so could be interviewed in the hospital afterwards. And those interviews would be along the lines of, you might have been depressed for a while or even thinking about suicide for a while, but at some point that ambivalence, that conflict within you resolved, and a suicide attempt was made. Simon asked, how much time passed between deciding to actually end your life and acting on that decision? It turns out it was very rapid. 87% of these folks said within the same day, within 24 hours. 70% within an hour. A quarter of them was within 5 minutes. There was the decision to attempt suicide, and then within 5 minutes it was acted on. And what that tells you is that in the majority of cases, when it's happening so quickly, same day, same hour, people use what they have. If in the bedside table there's a bottle of Tylenol or sleeping pills, that's what might be used. And thankfully, as I pointed out, 98% of people who attempt that way do survive. And they keep on surviving, as we'll talk about in a second. But if there's a firearm, unsecured, accessible to that veteran or their family members, that's what will be used, and death is much more likely, 90% likely. And that might explain why we know individuals with access to a firearm have triple the risk of suicide, accounting for all other factors. Areas of the country with higher firearm ownership, controlling for other things, have 50% higher suicide rates than areas with low firearm ownership. We know soldiers who carry their gun with them, carry off duty instead of leaving it on the base, have 4 times the odds of suicide compared to other active duty soldiers, just by having the gun around. Oftentimes, the response that I get when I talk about these figures, and what you might hear from legislators tomorrow, is, well, if we took away this lethal method you're describing, wouldn't people just find some other way? Right? This is something you'll hear tomorrow from chiefs of staff, from legislators asking about this. And in fact, Matt Miller, one of the leading researchers on firearm suicide, did a survey of Americans to find out how widely that belief is held, that in fact, if you stop someone, they'll find some other way. He asked Americans in a survey, if you were to stop someone from jumping off the Golden Gate Bridge, right, this is a highly lethal suicide hotspot in San Francisco. If you stop someone from jumping off the Golden Gate Bridge, would they just find some other way? And 3/4 of Americans said, yeah, most or all of them would just find some other way. It's widely believed. The reason that Matt focused on the Golden Gate Bridge in that survey is that that's actually been very well studied. There was a study going back to the 70s, looking at people that had gone to the Golden Gate Bridge to attempt suicide and either had survived that fall, about 1% of people do survive, or had been pulled off the bridge by the police or bystanders or caught in the scaffolding, just had survived, had been thwarted in their attempt and survived. He followed those 515 people for 26 years, the kind of follow-up period that I can't get funding for these days. But he followed them for a long time and found that less than 5% of them ever went on to reattempt to die by suicide. And those that did, it was almost immediately afterwards, while that impulse was still there. There's lots of studies like this. O'Donnell studied about 100 people that had jumped in front of the subway in London, which is, again, highly lethal, but it survived. Train had passed over them. Followed them for a decade, found that less than 10% of them ever went on to reattempt and die by suicide. There's meta-analyses of these, and the final numbers are about 93% of serious attempt survivors don't go on to die by suicide later. Most suicide deaths are on the first attempt, and so if that first attempt is lethal, death is likely. If the method used is less lethal, survival is much more likely. And there's been many examples throughout history of highly lethal methods being taken away, either on purpose or just through serendipity, and us seeing the suicide rates go down. I'm not going to go through all of these. I'll say things like in the UK, when coal gas ovens, which were a common method of suicide, famously Sylvia Plath died that way, when ovens switched to natural gas instead of deadly coal gas, suicide rates were dropped dramatically. In Sri Lanka, there was a big New York Times article about this just last week. In Sri Lanka, pesticides were the most common method. When pesticides that were very fatal in overdose were banned, the suicides in Sri Lanka dropped by about half. Actually, the article follows up with more recent data showing they've been dropped even more than that. When DC started requiring gun licensing back in the 70s, we saw a 23% drop in firearm suicides, just because it was a little bit harder to quickly access a gun. You had to get a license. And there was no replacement with other methods. Mike Anestis and Joy Anestis have done myriad studies looking at things that put a little bit of time and space between a gun and someone in crisis, and they found that they all decrease suicide rates. Allison Athey and I did a study of child access protection laws. These are laws that make it so that if there's a kid in the house and there's a gun in the house, the gun needs to be locked up so that the kid can't access it. It's a relatively common sense law that just keeps kids safe. We looked at states that had those laws and states that didn't, and found that passing child access prevention laws decreased youth firearm suicide by 14%. Now, veterans. Veterans tend to own guns at higher rates than the general population. About half of all veterans report owning a gun. Compare that to about a third of the US population. Now, firearm ownership is a constitutional right. That's important to all of us, and it's important to veterans. But how firearms are stored can be a public health crisis, and that's what we're here for today. Half of all veteran firearm owners store at least one gun loaded or unlocked, with a third of them storing a gun loaded and unlocked, which is, of course, a very dangerous situation. We also know that veterans who have a history of depression, who have a history of substance abuse, or have had direct trauma exposure were much more likely to store that gun unsafely. So the veterans at highest risk are at increased risk from these guns being accessible. We also know that veterans that self-reported themselves to be likely to attempt suicide in the near future were 7 times more likely to store their guns unsafely. So these guns are a match in a tinderbox. There's been reviews of different interventions that have been enacted by researchers and by the VA, by academic institutions to look at what does save lives. And we found that when studies give out free locking devices, as this bill would do, we see dramatic decreases in suicides, whereas we don't see them when they just give advice and counseling about how to store your guns. You got to give those devices out. That's what this act will do. So I'm not going to go into a lot of detail on the Saving Veterans Act, because you'll be hearing about it a lot. You've heard about it from Bill. But I will say that it's categorically different from what exists right now. Right now, to be a veteran who has access to a free gun lock, you need to be enrolled in the VHA, which most veterans are not, and most veteran suicides are among vets who are not enrolled in the VHA. This act would open gun storage devices up to any veteran, regardless of whether they're enrolled in the VA. Also, right now, these locks are provided just through the VA, through the prosthetic service of the VA. This would expand distribution so that many community partners like the AFSP or state health departments or other hospitals could get involved in the distribution of these locks and just get more safety devices to more veterans, saving more lives. Importantly, it assures funding for programs like this. Right now, these gun locks are sort of slapped together as sometimes line items in a budget of a particular VA, sometimes not. I actually give out gun locks at Johns Hopkins where I work, and I just get them donated by a variety of different, actually one gun store supplies them. And also we've gotten some from Project Child Safe, et cetera. This would centralize that. And also this includes public education. So all these things that I'm describing to you are things that many people might not intuitively understand. How much access to a gun actually leads to suicide death. You have these numbers now, and this kind of education would be funded for the general vet population and the general public because this can save lives throughout the country. All right, so in summary, this crisis is very real. The suicide rates are going up, and veterans are going up even faster. The crisis is driven by firearms. We see a disproportionate use of firearms by vets. 3 out of 4 veteran suicides are by firearms. We know that there is a risk in unsecured access. When a firearm is locked up, it gives time for that crisis to pass, where they can't access that firearm. And we know that putting that time and space between a veteran in crisis and an unsecured firearm is very likely to save their lives. So I just wanted to close with that. You don't need to see a bibliography. And turn it over to the next speaker, who I believe is Chris.
Good morning, everyone.
How long was that?
So first off, the title is Master Sergeant Retired Christopher J. Allen. That's a mouthful, right? So also known as Chris. So that makes it much easier. So another clarification, Laurel mentioned the 1/151 that she talked about. That's the 1st Battalion of the 151st Aviation Apache Battalion in South Carolina, so a little clarification. The 1 is for the 1st, and if you talk to the Apache Battalion, the battalion, not just the 1st, the battalion. So, how many were here last year? Raise your hand. All right, so a lot of you, so this story won't make sense to you. So, last year, Monica Johnson came up here and talked about her ordeal to get here to the forum. I hear laughter, so I'll give you a very brief synopsis. So, she starts off in Atlanta around 3 in the afternoon after 4 different planes trying to be used to get out of Atlanta, like, I don't know, 7, 8, 10 hours later, something like that. She finally gets here. It's late at night. She goes to her hotel room. She comes back the next morning ready to, for the presentation. Realized she had the wrong hotel, right? So she gets here and eventually, not here, but to the location, and she gives a wonderful presentation. I love her storytelling. She throws a lot of y'alls in there, so being from South Carolina, that correlates with me. I appreciate it. So I say that to say this. So I was excited. I'm always excited to come here to the Advocacy Forum. It's one of the many things I look forward to every year, but one of the top things I love coming to every year to be able to be the voice. And so, I made my flight reservations, early on. I made sure that everything was all set up. My calendar was clear, took the vacation days, everything I needed to do. I was excited. I'd been talking to Alex Silva about veterans programs. I've been talking to Bill about veterans programs. And then I get a letter from Laurel inviting me to speak on the panel. Great, right? But then I have a flashback of Monica's experience. So I canceled my flight. And I drove from South Carolina instead of flying. So my experience getting here was much less eventful. It was a nice drive. All up 95 connects South Carolina to DC very easily. I did have some 988 experiences because That's what we do. I mean, even though we're in the third year, it's amazing how many people don't know about 988. So I'll just ask people, do you know what 988 is? And a lot of times, still 3 years later, we get blank stares. So I stopped a couple of times to get gas and snacks and stuff like that, and I would ask people, have you heard about 988? One did, one didn't. So in that, it's 50%. I would love to think that it's 50% out there in the general population. But even in my own community where I work, where we are a helping agency, there are still people within our agency that don't know about 988. Yet we have signage everywhere talking about that. So I say that to say this: keep talking about 988 and don't just presume that everybody knows about it. So you see this picture up here, one in uniform, one as a civilian. So I recently retired from the military after 26 years of service back in March. April 1st was my first day as a civilian. I thought that was kind of funny. But today I wanted to share 3 things with you. Why this work matters, where we've made progress, and what we must do next. And along the way, I'd like to share a little bit about my own story. So way before these pictures were taken, back in 1984, so way back in time, before we had PowerPoint presentations, we actually had slide decks. You press a button and you drop slide, right? So, all right, so those had issues. We had problems with PowerPoint presentation. That's always gonna be an issue. That's never gonna go away. We're always gonna have issues. But this is a long time ago. Computers were a new thing. I was excited about computers. And so my path to learn about computers was to join the Navy. So I, being from, at the time, North Carolina, went up to Chicago in December. Maybe wasn't the wisest choice to pick that time of year to go up there, freezing my tail off up there. But came together with 80 other folks from around the country, had a marvelous time, a lot of good experiences. It was the most challenging thing to that point that I've been through mentally and physically. And at the end, whenever we all graduated, there were about 20 less of us, 20 people, went home. And those, that were left that were talking, we were talking about our experiences and how it was challenging. And a lot of folks, and even in that circle that graduated, there were many times during that they wanted to leave, myself included. And so, I started thinking, and then there was one experience during boot camp where one person got injured. I'm pretty sure his arm got broken, but he continued on. And so, at the end, I'm thinking about this, why did we not go get care mentally or physically at the time? And here's what the thing is, and it's not a rub against the government or the military or anything like that, it's just a fact of life. There's only so much time that you can miss during training. If it's a 10-week training, you only miss a couple of days and then you get recycled, you get sent home. And that was the same message that I was hearing from every other person. They did not reach out for help, whether they literally needed it, like they needed a cast, or they needed somebody to talk to about what they were experiencing. They did not seek help because they did not want to get sent home. They didn't want to get recycled. That's just one, that's the first training that you go through in the military. I don't care what branch of service you go into, we all go through that. And then we go through schools. And every time you go to a school, they say the same thing. If you miss too much training, you're going to be sent home. And then the next thing. So by the time we get to combat and we experience things, where it's ingrained in us not to seek help. Now, it's not planned, and nobody goes out and says, we're going to train people not to seek help. It's just a fact of life. I wish that I had all the resources from today, 2025, back surrounding those service members back then, myself included. It would have lessened a lot of the stresses that people experience the sooner that they get help. So I first advocate all the time early intervention. Whenever you feel that you need to get help, go get help. Don't wait. Don't wait just because if I miss some training, I'm going to miss out. People seek help all the time. If you sent every person home in the military that sought help, we wouldn't have a military. But a lot of people don't realize that. It's a myth out there. So definitely advocate for your friends and your family members in the military. Seek help early. So, next slide. This is how I learned about legislation. Those of you who may know Bill, I've learned a lot from this bill, but this is the first bill that I learned about legislation from. Those of you that don't know who this is, you're going to have to Google Schoolhouse Rock. I gave you all the information there, and please watch the episode. I thought about playing the episode. It would have, some nice flashbacks for a lot of us. But Bill, Saturday mornings, would talk to me about what it took to get an idea all the way through to completion to be law. And so I want to thank Bill for that. Today's, bill that we're talking about is Saving Our Veterans Lives Act, the House 1987 and the Senate 926. So thank you, Bill, for that. But we've made progress in other places using this method. We have the 988 suicide crisis line that we know portions of it are under attack right now. We have in place in schools, workplaces, military installations, mental health training and peer support that we didn't have before, thanks to legislation. People with lived experience are stepping forward to share their stories, breaking the silence and showing that recovery is possible. And more, we are recognizing that suicide prevention is not just crisis response, it's about connection, belonging, and hope. We have to get to know our representatives. They represent us. Republican, Democrat, it doesn't matter. This is my representative, James Clyburn. In our area, in our district that he represents, we have Fort Jackson, which is active duty Army. We have several National Guard armories in that area. We have the Capitol there in his district. We have all walks of life in the area that he covers. He covers basically from the Capitol almost to the coast, and then as you can see, top to bottom, most of the state there. So he covers a large area. But here's my takeaway from this slide. You have to know as much as possible who's representing you, and you need to help them learn who you are. If I only took away what I heard in the 15-second sound bites about James Clyburn, maybe we wouldn't have a lot in common. But whenever you actually talk to him and you hear him speak for longer than 15 seconds, he talks about the district, he talks about the military, he talks about his family. He talks a lot of things that are important to me. And so that as I connect with him on a personal level and connect with the staff on a personal level, and they get to know me, they will respond. And tomorrow is just the start. And like Laurel said, even today, start today advocating. But when you advocate for these bills starting tomorrow, they don't get passed tomorrow. They get passed in the future. So this is just the beginning. Make sure you make contact with them. Learn their email addresses. Send them emails. Send them reminders. Stay in touch with what, put on your trackers what's happening to these bills. And so that you're notified, connect with AFSP, get on their advocacy email list. Make sure that you're connected. Connection is definitely where it's at. As we talked about already, same slide that you already saw, from the time that someone thinks about suicide to the time that they take action on that is relatively a short period of time for most of the folks who die by suicide. So here's a picture of a house, not my house. This is a very nice house. This is a 3-car garage. I don't have a 3-car garage. My wife would probably love it, but it's not in the cards. So this bill provides lockboxes. In the military, we train, it's not just about the lockbox. It's about the story around the lockbox. Why are you using the lockbox? So we recommend that you put things in the box or outside the box or outside your safe or connected to the gun lock of tasks that you can do before you even open the box. This is just a short list. Go for a 1-minute walk. Write a letter to yourself or have your family members write letters to you. Put them with the lockbox. Read that. It takes 3 or 4 minutes to read an average letter. Call a friend. It says 2 to 50 minutes there because it depends which friend you're talking about. Some friends want to say, okay, and then done, and some will hold you. If you're feeling a certain way and you need some time, call that person that you've been avoiding because you didn't want to get into a long conversation and talk to them. You don't even have to tell them why you're calling. Just call. You can put pictures of whatever you want to put pictures in there. That can take 1 to 5 minutes just perusing pictures or longer. You can call 988. That can be a short or long conversation. The safe itself and unlocking the weapon itself does not take time to undo. So what I like about the lockbox and the locks is that it typically comes with a conversation. When we have them on our tables and we're handing out locks and somebody takes one, we talk about the lock. When they sit in front of a provider or a community partner and they're given a lockbox, it's a conversation, it's a connection. So it's the lockbox and the lock is less about the item itself. They're necessary because we want to take out any kind of hurdle or barrier to keeping a weapon safe, as we've talked about, already this morning, but do more than just that. So just like I said, today is just the first day. It's not the beginning. I mean, it is the beginning, but it's definitely not the end. But here's where each of you come in. We don't need to be mental health professionals to make a difference. We need to be the friend who checks in, the coworker who notices, the neighbor who listens, the leader who builds a safe and supportive space. When I think back to boot camp and the people I trained with, I can't help but wonder what might have been different if they had felt that they could speak up about their mental struggles without fear. We must create a world where that is not just possible, but expected. So here's my challenge to you today, and it's similar to the challenges you've already heard today. When you leave this forum, take this conversation with you. Bring it into your homes, your workplaces, your faith communities, and schools. Normalize talking about mental health. Learn the warning signs, ask directly, listen without judgment. Connect people to help. Continue to reach out to your representatives until this bill passes. Look at tomorrow as just the beginning, because suicide prevention is everyone's business. It's not just about pulling people back from the edge, it's about building a world where fewer people ever get to the edge. As we've already talked about, we are all advocates all year round. I'll close with this. There is no single solution to suicide prevention, but there is one certainty. Together, we can save lives. Thank you for showing up, because when you show up for suicide prevention, you are showing up for life. Thank you for your time, your heart, your commitment. Keep going, because hope is contagious, and so is action.
Good morning, everybody. Well, Bill and I were discussing what is DAV going to present for you all, and how do we relate the veteran's voice. And I think that was the best thing that Bill and I came up with as a veteran. I'm a service-disabled veteran, and I am a Gulf War veteran. And I told Bill, I think the best thing is not a PowerPoint, not statistics. Let's talk about the veteran's experience. I lived that experience, suicide. I survived the attempt, the thoughts, the hope, losses, the helpless feeling. I turned to DAV in 2003. As my bio said, I joined the DAV as a National Service Officer in Fort Snelling, Minnesota. And then I thought about the world that I was in as a veteran, and a veteran also in the Veterans Organization, and the many hundreds of thousands of veterans' issues that I was hearing day in and day out, and reliving through their memories, my experiences. And I thought maybe because I'm in front of those who have been challenged with this personally, those who have supported loved ones, and those who are in the research world, and those who are clinicians. First thing first, all of those who have gone through it, it is okay that we went through it. It's real. And I do appreciate all the speakers, even the first panel, talking about it's a real issue. And I appreciate the guests talking about we need to have that discussion. There is something that is interesting, as the Master Sergeant talked about. It's a culture. I was an infantryman. I was a grunt. I think he'll know what I'm going with this. In the grunt world, 11 Bravos, infantry, there is a culture. And the medic is not part of that culture, unless we're in a combat zone. Doctors are not part of our resource to be thought of, to turn to. And it's not about only that we are going to, it's not something normal for us to do because of some simple reason. No, it's an expectation. They want us to be mission-driven. We used to always say, if we're lucky, we live to fight another day. But we knew in the infantry our numbers were short. And we knew that reality. But like my wife says, my true commander-in-chief, my wife, she was a military wife. She understood the life of military. She was military brat also. So she understood having a parent go to combat and her husband always on alert, potentially going to combat or going to combat. She understood it, but she didn't understand one thing, and that is why I never sought help. It was not acceptable. It was a sign of weakness for infantry to even seek help. We took medications like there was no tomorrow for pain. So now we deal with a psychological issue and a physical issue. No different than this nation's citizens that suffer with mental health and even think about suicide. Multiple facets impact our lives. As a National Service officer, I come to realize that's what we struggled with too. Every veteran that came to us, combat or not, service disabled or not, because service disability is only on the notion that VA grants it to you. It doesn't mean VA is right when they deny a veteran. So you think about those veterans who don't get service-connected. They're not even acknowledged that their injuries were really because of service. And that makes an impact to their physical well-being and their mental well-being. So when I was thinking about this with you all is how do I make this really impactful enough that it matters to what you're doing? Being here, first and foremost, is so important. The bills that we are talking about today, bipartisan bills, Saving Veterans Lives Act, is so important. We were very fortunate as DAV to talk to the congressional members about this, especially DeLuzio and King. We talked to their staff about why this is important. Now, I kind of introduced myself as I am the survivor of suicide. My handgun, my Beretta, ironically, the issued weapon that I had in service, is the weapon I have at home. My 9mm was my best friend, was my backup, and was there with me every day, every night in service. Even to the point, one of the statistics, I had one in the chamber under my pillow. Luckily, I had a guardian angel in a couple different places, my wife. And that's very, very important. We talk about family, and I know I'm talking to you family out there. And my condolences on any of you that have lost. But my heart goes to you also for those who saved the lives, because I know my wife was one of them. I went through the psychiatric treatment as a veteran dealing with mental health, PTSD, depression, anxiety. Kind of sounds a little weird hearing all three of them. The reason why I want to do this, especially for our researchers and clinicians, veterans are unique, as we saw the statistics. We are more likely. We have more access. And the thing is we don't fear our guns. We have been around it in the culture, especially certain MOSs. It is what we're accustomed to. It's norm. But again, having the families there to be that. Bill and I were talking out there about 988, okay? Veterans, 988, press 1, right? We heard speakers talk about that. Talked about option 3s and different ways to. It just dawned on me yesterday when I was preparing to speak in front of you all. A commercial showed up, first time ever. Do you know what that commercial was? 988. But that's once in how many years? Now I'm going to say something that's even more disappointing. VA. When I go to VA medical centers and I go to a CBOC, do you know that I don't even see in my CBOC 988 press 1? It's not across the board, but I think it goes to, again, previous speakers. We have to get the word out. It's not just about us. I can tell you, I go to so many seminars, panels. We're here because it's important. But look at us. Look around you. How big are we? Are we about 70, 80 strong right now? But that's only 70, 80. Trying to save the lives of not just veterans, but for you all, because you have multiple missions, is save all the lives of this nation that are suffering with mental health and suicide. I heard minorities, but I heard a discussion about LGBTQ+. And I thought, okay, I walked into an organization, a foundation, who's got a very important mission. But it's not just veteran-centric. But I thought, how do I help them talk about when they are not veteran-centric to amplify their voice? LGBTQ+, minority, they exist in the military. They exist in the veteran community. And what I would share, because we talk about lobbying, we talk about how to amplify that message. Do it on the backs of veterans. We served. Veterans will not object. Take our platform and remind them we are part of the LGBTQ+, the minority, the women veterans that suffer. I can tell you it is bipartisan, but we know one thing. This is one thing I haven't heard any of the speakers say. I heard a little bit of the Democrats are good, Republicans are there, but reality is this. Reality is this. No politician is going to ever tell you they're not for suicide prevention. And they're not for veterans. But the reality is, and I think they said it very well, you hold them accountable to their promises. You have to do that. But what they need to know is this. The family members here who lost loved ones, tell your story. Those who suffered with mental health, also tell your story. That's what they're looking for. I can tell you when I testify, that's what I have to do. I have had to tell them, no, VA did not give me a cable lock. They knew I screened positive for PTSD. They knew I had suicidal ideations. They knew my psychotropic medications created more problems. They not once offered, in my over 10 years of therapy and seeing VA, a gun lock cable. That's coming from VA. So take these hard facts that we know that, and I'm not the only veteran that suffers with this. As an organization, we are wanting to ensure that we put the voice out. So DAV, Paralyzed Veterans of America, and VFW, we're talking to Congress about budget. We're talking about infrastructure, clinical needs, as far as clinicians and everything. Those are things that we do. But what they need to hear from you all is the real stories of the tragedies that they're missing the beat when they are not fulfilling their promise. So I'm sure we're going to get into more of a panel discussion later, but this is the message I really wanted to share with you from a veteran. I want to thank you all for the hard work you do. Remember this, over 6,400 lost in 2022, but the reality is this, out of the 9 million veterans enrolled in the healthcare system and the 18 million veteran population, 0.0035 is what we unfortunately lost. But look at how many still live. And that's what we have to keep remembering, is we have to keep them alive, because every day, every week, every month, every year, they're challenged with not taking their life. And one shout out for our women veterans. Our women veterans are veterans. Remind your congressionals that women veterans, and it was a stigma that they don't own handguns. They do. They own weapons. They are military. They are veterans. They come from the culture of being tough, having to be tough, and so we have to break the stigma. Remind them and be very inclusive with our women veterans. Plus, our women veterans are challenged with the higher rates of military sexual trauma. They are mothers. They go through also hormonal changes. So do amplify their voice. Just in good note for us, and I want to shout out to all our women veterans. I hope you're all enrolled in the VA healthcare system. We're so proud this year that we have almost 1 million women veterans enrolled in the VA healthcare system. And as we heard from previous guests, suicides are happening outside primarily when they're not in VA healthcare. And also, other thing is this, VA healthcare is also community care. The standards that are in the VA, you must also amplify that voice in the community. Gun locks should not only be offered by VA, it should be offered by anyone. And DeLuzio, just so you understand, Representative DeLuzio, when he looked at his bill, he did not care if someone was not a vet, got a box, because it saved a life. That's the logic, common sense that he had, and we want to make sure you guys understand the direction DeLuzio and King are going with this idea. $500 million is nothing. It's a drop in the bucket. They can do more and hold them to it. So I know we have champions here. We have very loud voices, and I know you have the passion. Keep up the fight. DAV is right behind you, and I can tell you so is the IBVSO. Thank you.
Incredible panel with incredible information. What I want to do is invite you to send questions into the WAHOVA app, and I'm going to curate those and ask some questions. So have those come on in. Let me tell you a little story to set some just sort of a clinical perspective on this. In 1986, I was a brand new intern at the DC VA Medical Center just over there, Northeast DC. And one of my first patients that I had was a former Navy SEAL. So the elite of the elite. He was a really compelling young man. And in the course of his service, he had about 4 or 5, I gotta say, like major medical mishaps that probably in the public sector, private sector would have been lawsuits. And he was just trying to get service connected. And relevant to your day tomorrow, when he first came to me, he said, I'm really struggling with sleep. And he started telling me all of his tales of woe about his service. He was once running through a submarine, and he banged his knee on a torpedo, and they did surgery the next day on the other knee. It's called a wrong site surgery. So he had 2 bad knees, and it got worse from there. So he said, I have these recurring nightmares where I'm up on Capitol Hill, where we'll be tomorrow, and I'm surrounded by congressmen and senators, and I'm glaring at them because I just want to get service connected to carry on with my life. And I eat my gun and blow my head off. And I'm like, oh, okay, so that's really serious. Do you feel suicidal? He's like, no, I don't want to do that. I served, I want to find a way to make it in the civilian world, but I've had this recurring dream. I told my supervisor, he said, let's get the gun out. I went in for my next appointment. I said, my supervisor says I have to tell you to get the gun out. He's like, okay. He gave it to his dad, and that was in August of 1986. In July, so my 3rd rotation through the VA, my final rotation, he comes in after battling and battling to get more service connection, and he had a really bad day. He's working as a realtor, and he's hobbling around on his bad knees, and he gets fired. He goes to his girlfriend's house, and they get in a fight, and she breaks up with him. It was literally like the worst day of his life. He goes to a bar, gets wasted, goes home, goes to his Foot Locker to get his gun. Forgot he gave his gun to his dad back in August. Comes in the next day, meets with me. He's like looking sheepish. Yeah, you got me through a really hard time. And he told me the story, and I was stunned. And we finally did get 100% service connection for this man. But that's an example, a case example that I went through where That's all it takes sometimes in certain situations. And he said, I was so glad, because I'd totally forgotten, that gun wasn't there. So with that, I want to invite you to send in your questions. Apparently you're all mesmerized by these great speakers. Do any of you have comments about each other's presentations that you'd like to share?
Well, I would just say again, the importance of what you're going to be doing tomorrow in helping to elevate this bill. I think you've just heard about the importance of this, and Dr. Jobs, I think that is such a great example. In that case, of course, that's firearm transfer, but the same can be said, again, for children and youth in the home of a veteran. If they would otherwise have maybe a terrible day, they get home from school and might otherwise have access to lethal means, again, having that lockbox to weather that moment of crisis, just imagining a hypothetical here, again, a child, maybe they've been bullied at school, maybe they've gotten a bad grade, maybe it just feels like a crisis they cannot bear. Well, if they have access to a firearm, that could end in a tragedy, but if instead that firearm is kept in a lockbox, I think that is a core part of saving the lives of children across this country, saving the lives of teens and young adults, and also other family members, again. And I just want to mention, too, I hope it's okay to say, John and I were talking before this panel, Chris, I think this also gets to what you were saying about the importance, too, of putting a letter from a loved one, putting a photo of your loved one in a lockbox, maybe having the branch you served in on the lockbox to remind you of the importance of that mission, the importance of your life, and why your life is still worth living, so that if an individual is in that moment of crisis, and God forbid, if they might otherwise be at that moment, having that reminder of why they should stay here, of the people who love them, of why life is still worth living. A lockbox is a great way to put a safety plan in there, and otherwise, it's just an excellent way to help prevent suicide and help individuals weather the worst days of their lives. I don't know if anyone would have anything they would add or if we have questions. But
we do. They're on Laurel's phone, apparently. How is the bill funded, and how much does it cost to provide safes and education?
That's a great question. Right now, the authorization amount is $5 million. I will say this is a new bill. And I think as you heard from a couple folks earlier, especially at the federal level, it can take a long time to get a bill passed. And during that process, it's going to go through revisions. The bill as it's written right now does not need to be the final bill that passes. I think the lead sponsors, as you said, Chris DeLuzio and Senator King especially, are very open to friendly amendments right now, very open to thinking about what the right level of funding would be. But again, right now it's an authorization amount of $5 million. It's important to note what that means. When a bill has an amount authorized for funding, that's just authorizing the Congress to spend up to that amount of money on that priority. So an authorization amount is not directly appropriating it. The way it works at the federal level is when you pass a bill that has an authorization amount, the appropriations committees for both chambers then decide, okay, how much should we fund that at? And then in the appropriations bill for each fiscal year or a continuing resolution, as is often the case, you'll see the exact amount that's funded. But right now it's $5 million per year.
Will the VA have units on hand for immediate pickup? Do vets need to go in person to the VA, or can they request them to be shipped or purchased online?
So the idea behind the access to the storage boxes would be that they'd be on site. And one of the things that challenges the score was how we would get them out to community. So the focus is to have them at VA medical centers and the C-box. Initially was how Representative DeLuzio was looking at. And the other thing I just wanted to add that Bill was talking about on the first part is this. You may be asked, why does VA need a gun box when they give cable locks? And it's really going back to where the Master Sergeant and I are talking about the military culture. You have to understand culture, is that cable locks don't exist in the service. We do turn them into the armor, and then when we are out, though, majority of us favor, because of the tactical accessibility of close quarter combat and quick reactionary, we prefer a gun box. So when your representatives or any congressionals try to say, well, VA already gets funding to do cable box, push back on them. Give the service member, give the veteran, give the people who are gun owners what they use to create that time and space. And again, like Chris was talking about, this is something that, or what Bill was talking about, Chris DeLuzio was very open to the idea, because DAV said something, because going through that, you have to create time and space, and our researchers out there. If you ever look at gun locks, boxes, it's only a physical barrier. And if you look at the people who have gone through it, what snapped us out of it, it's a psychological component. And that's where I was sharing with Bill about having a picture. And VA actually asked, what if we made their branch seal and put it on the box? And I said, do one better than that. Not only that, put 988, press 1, you matter. And the reason why I bring that up, because I have an opportunity with clinicians and researchers. When you research this and clinicians, you look at this, you can't just give us a physical barrier that's a lock or a key, a combination. I can get at it quickly, I'm in. If it doesn't stop me psychologically, and I told Bill, what I proposed to Deluzio was, and VA is on board with this part, the psychological, the visual. There it is, my family picture, my favorite dog, my favorite car, whatever it is, my branch seal, 988, your life matters to you, branded on front. As soon as I open the second part I said is another psychological, an auditory, like our gift cards. Holiday cards that sing a song but a voice. Dad, I love you. Honey, you mean the world to me. We need that time and space. It's not about physical. When you talk about veterans, we know how to breach physically. It's the psychological part. You have to shut off our quick reactionary component to carrying out a mission. So you got to put a deep pause in there.
These units are for handguns and smaller firearms. What about long arms?
It's a great question. It's not specified in the bill, and if the bill is passed as currently written, that would be up to the VA to make determinations about what exactly would be done for long firearms, for rifles. It's an excellent question. Yeah. Oh,
Right now, their focus is on handguns.
yes. And I should mention, too, that's borne out by the data. Most firearm suicides are by handgun. It is relatively uncommon for a firearm suicide to occur using a rifle or otherwise a long firearm. That is the reason why the focus is on handguns, as you said.
Can
Yeah.
Or the ammunition.
Yeah.
Okay, I've gotten the cue that we're done. The final thing that I'll say, which has been raised here before, you are constituents. These people work for you. You have to be snarky about it, but you can remind them. You can remind them about that they work for you, they represent you. This is a bill that we really want. Thank you all so much. We appreciate you.
Thank you.